Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I'd like to talk about a condition called PMLE and what it is and how to avoid it and how to treat it. PMLE stands for Polymorphous Light Eruption. Do you or someone you know ever go away to a sunny place in the middle of the winter and get a really bad itchy rash all over every time, no matter what sunscreen you use? You can't figure out if it's an allergy to sunscreen, and you keep switching brands, but it happens every time you go on vacation. If this story is familiar to you or someone you know, keep listening, because this is polymorphous light eruption. It's a fairly common condition, and people who have it will recognize the description of what it is, and they are often so thankful to know that it has a name and that they are not crazy. They're also happy to hear that it is treatable. It often goes away by the time the vacation is over, and they do not seek medical attention for it, and it remains a mystery to them. They forget about it until it happens again the next year. It can also happen to people who live in areas where there are changes of seasons, and at the beginning of the summer, the rash happens every year. But it gets better as the summer goes on, and again, often it goes away, people don't see a doctor, but they don't really know what this is. It's PMLE, polymorphous light eruption. It's a sensitivity to sunlight. It's almost like an allergy, and it usually happens on sunny vacations and at the beginning of the summer. It's a red, blotchy, itchy rash, often on the arms and legs and trunk. It's less common on the face. It's not contagious, and it's not an allergy to sunblock. So now that we know what PMLE is, how do we treat it? Firstly, I tell my patients to take oral antihistamines as the vacation starts or early summer starts, any antihistamine of choice. My personal favorite is Allegra or generic fexofenadine, but Claritin or Zyrtec or Zylzal or any of them really should work, whichever the patient prefers. The best thing is to take it every morning to try to prevent the rash and not wait until the rash comes out and taking it afterwards. It will not work as well that way. Secondly, I tell my patients that in terms of treatment, the best thing is a great zinc-based sunblock. It should be an SPF of 30 or above, and you have to reapply it every 1 to 2 hours. The zinc oxide reflects the sun and prevents it from even hitting the skin, thereby preventing the rash. Zinc-based sunblocks are often thick and creamy. However, there are some sprays or lighter versions. I happen to think the thick and creamy versions are probably better for preventing this rash. However, any zinc-based sunblock will work. You have to read the back of the bottle to see what the active ingredient is in the sunblock, and you want it to say zinc oxide in that category of active ingredients. Other types of sunblocks might also work, but zinc is thought to be the best for this. Thirdly, I tell my patients they need to wear clothing and they need to seek shade. SPF protective clothing, which you can buy online or at some stores, is really helpful, but regular clothing can work as well. Hats are important. Anything that blocks the sun from hitting the skin directly will help prevent the rash. No sun, no rash. So protect the skin as best as possible with clothing. Fourth, I will usually give my patients who have this condition a prescription steroid cream so that they have it to bring with them on vacation to put on their skin twice a day if the rash comes out. In the absence of having a prescription steroid, there are over-the-counter hydrocortisone creams and ointments that can be helpful, but prescription strength is better. If the patient gets the rash, then cool compresses can be soothing, and avoiding the sun is key. So in summary, PMLE, or polymorphous light eruption, is a common condition that affects people when they go on sunny vacations or at the start of the summer. It's a red, itchy, blotchy rash that often gets confused with an allergy to sunscreen. The best way to prevent it is with oral antihistamines, good quality zinc-based sunblock, protective clothing, and sun avoidance. If the rash comes out, the best way to treat it is with topical steroid creams. The good news is the PMLE usually gets better as the vacation goes on or as the summer season goes on, since the skin gets used to the sun and the rash goes away. It's good for the skin to avoid sun anyway, so best to keep up the good habits like wearing sunblock and protective clothing even if the PMLE is gone. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.